Welcome to the Fat Emperor podcast. I'm your host, Ivor Cummins.
This topic of thyroid comes up quite often, I find, and hypothyroid or, problems relating to thyroid, and they even interact with cholesterol, as in poor ratios and cholesterol markers can link to thyroid problems. And I don't mean to go on, but there's another thing that, low carb diets can lower your thyroid and leave you with challenges there. So there's a whole lot around that area. So it'd be great for you to give your overview of thyroid issues and thyroid function as it relates to low carb.
Oh, right. Well, okay, honestly, I don't see huge differences between low carb and regular diets in terms of thyroid function. I see a little bit increase in reverse T3, which is basically pointless on low carb diets, so I never measure it, I never worry about it, it's not a big deal. I would say hypothyroidism is a massive epidemic. I mean, 1 in 10 women in this country will have it during their lifetime. Most of it's autoimmune, Hashimoto's disease. You're making antithyroid antibodies and attacking your thyroid. I'm sure there's something in the diet that's driving this autoimmune phenomenon. I don't know what exactly, but it's something we see all the time. My advice to everyone, there's a million thyroid tests, and there's a lot of quackery on both sides of the aisle when it comes to thyroid. You've got your standard doctors who are just only ordering a TSH and only giving you levothyroxine if your TSH is in the double digits, and that's it. That's all they ever do. And then you've got a lot of functional medicine people who are constantly tracking antithyroid antibody levels and all these, reverse T3 and all the, you can have a full thyroid panel over and over and over again. It's really not that value added. And honestly, 99% of people out there just need maybe a TSH, a free T4, and a thyroid peroxidase autoantibody, this one antibody test. If the antibody's positive, you've got an autoimmune disease. It's not helpful to track it over and over with time because those antibodies are almost always positive for the rest of your life, the same way your chicken pox antibodies positive for life, or your measles and mumps and rubella antibodies are positive for life. So you check a thyroid peroxidase autoantibody, TPO. If it's positive, you're going to probably have problems with low thyroid, maybe for the rest of your life. And then you track TSH and free T4. I like TSH around 1.0. That's what your brain emits if it wants more thyroid hormone. And then if you just have a sluggish thyroid gland, you can take levothyroxine and lower your TSH and normalize it. Some people have central hypothyroidism. It's a lot more rare, but they have a pituitary problem, and that's why you might want to check a free T4 in addition to a TSH. But for 99% of cases out there, you really just need a TSH, a free T4, and a thyroid peroxidase autoantibody really just once. And then it's mostly tracking the TSH and normalizing it with either levothyroxine or a little bit of liothyronine, which is T3.
Gotcha. That's a great summary, Ted. And for people with autoimmune, as they say, the antibody or the problem, a bit like type 1 diabetes, it stays with you even if you take away any injurious agent that drove it. So,
Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, a free viewing of the Widowmaker movie on the far right, and myself and Dr. Gerber's book, Eat Rich, Live Long, on the left. Otherwise, please do subscribe to the audio podcast. Thanks.